Good morning. It's a pleasure and an honor to be with all of you today. And I'm going to talk about the 10 attributes of a health literate organization and where we are and hopefully where we can go around this area. And a lot of the work I'm going to be presenting this morning was commissioned by the IOM Roundtable on Health Literacy, and our report is available at the IOM website. Hopefully many of you have had a chance to look at it. If not, I encourage you to take a look. And this report was put together by faculty at our Vanderbilt Center for Effective Health Communication. So I think many of you are aware many of the studies to date in health literacy have really focused at the patient or individual level, demonstrating that patients with lower health literacy can have poor knowledge, self-care, and even worse health outcomes. But the majority of studies have focused only on individual health literacy or patient-provider communication, and often don't consider larger system-level challenges related to health literacy. So you heard Dr. Koh this morning and others really talk about this paradigm shift where we really do need to move from thinking about health literacy not just at the individual patient level, but really at the health system or organizational level. So when a patient interacts with a healthcare system, yes, they're communicating directly with a provider, but there are many other facets of that organization that are at play and impacting the patient's health. So they may be interacting with support services such as translators or patient navigators. They may be getting information. They may be getting something in the mail to tell them about their appointment. They have to understand that to know even when to come into their appointment. They get to their appointment. They get a clipboard of materials to sign off on, HIPAA and other things. Then they see the provider. There may be nurses, dietitians, other members of the healthcare team coming in. And then after they go home, they may be dealing with bills, insurance, and other issues. So there really is a whole system level of activities going on that patients or families need to navigate that can impact their understanding of their health, their ability to perform self-care activities, and have good health outcomes. And we really need to think about what's going on at the organizational level and whether or not that organization has policies in place, training of staff, good materials available for patients so that patients can have the optimal experience for their health. And so, as many of you know here on the Roundtable, you put together a work group to specifically address this issue, and there's now a definition that a health literate organization or healthcare organizations that make it easier for people to navigate, understand, and use information and services to take care of their health. And there are 10 attributes that have been identified of what is a health literate organization. Hopefully you're all familiar with this, but this includes an organization that has leadership to address health literacy, that integrates health literacy into planning and a host of other activities at the health system, that trains and prepares their workforce, that includes populations with a range of health literacy skills in the work that they're doing, that addresses interpersonal communication and provides low literacy information, and really thinks about all the different ways that patients may interact with the health system, whether it's via the phone or computer, or even as they walk into the building and see the signs to navigate them to the clinic. So the aims of our work, which was commissioned by the IOM Roundtable, were to identify and assess current measures for assessing organizational health literacy, and also to try to reach out to current organizations to understand how they're currently measuring and addressing organizational health literacy. So we performed a systematic review to try to identify measures of organizational health literacy. We did a Medline search for articles and abstracts that have been published where groups are trying to measure organizational health literacy. We included all English language articles from January 2004 to February 2014, and we focused on measures that we're measuring literacy at the organizational level. So we excluded individual measures of health literacy or review articles. But we also recognize that this is a very young field and there may not be a lot of measures already published, so we also did a search of the gray literature just by doing a Google search, but also by reaching out to experts in the field, using listservs, and using a snowball sampling process to try to identify additional measures that organizations might be using. Once we identified potential measures, we had a single reviewer review those measures to see if they were relevant to organizational health literacy, and if they were, we had 2 independent reviewers review the measure to see how well the measure addressed the 10 attributes of organizational health literacy that had been identified by the Roundtable, to see what kind of work had been done to validate the measure that was developed, and also if the measure was being used and how it was being used by organizations. We had a 3rd reviewer when needed to reach consensus, and then, as I mentioned previously, we contacted organizations using snowball sampling to try to understand how they were using these measures in the real world. So these are the results of our work, and this is a little bit small, but we reviewed almost 2,000 initial articles that were identified, as well as 59 other sources that were sent to us through the snowball sampling and gray literature. And from that, we condensed down to 68 measures that we identified that were addressing organizational health literacy in some capacity. 12 of the measures we considered very comprehensive, addressing 5 or more of the organizational health literacy attributes. Another 27 measures were addressing between 2 to 4 of the attributes, and then another 29 were focused on just one organizational health literacy attribute, usually focused on interpersonal communication. So this very heavy-duty table represents the measures that addressed 5 or more organizational health literacy attributes. And you can see a few of them actually address all 10 of the attributes. The other thing I would point out is very few address attribute number 10, which has to do with how patients understand cost or billing information related to their health. And I think this is a really important issue that's becoming more and more important as we put more onus on patients to pay for their health care. And we recognize that there's not a lot of transparency right now in cost, and there's more demand for increased transparency in cost. You know, for those of you that get those explanation of billing forms to your house after you go to the doctor's office or the hospital, it's a real disaster. So huge opportunities there to look at what organizations are doing around explaining cost issues. These are a few examples of some of the more robust measures that we identified. The Enliven tool addresses all 10 of the Institute of Medicine OHL attributes. It consists of 85 items. It's basically a checklist of items to ask an organization if they're addressing the 10 IOM organizational health literacy attributes, and it's designed to be completed by the organization. So this is just an example asking them to say, do you have things in place addressing, for example, if you have an explicit commitment to health literacy in your mission statement, if you have established policies and procedures for receiving and addressing language assistance concerns at your institution, and so forth. Another tool which has been mentioned this morning is the AHRQ Universal Toolkit. It's a 227-page compendium of over 20 tools and measures designed to be completed by staff and/or an organization. Within that toolkit, there is a 49-item health literacy assessment items questionnaire, and it covers whether or not your organization is addressing spoken communication, written communication, self-management and empowerment, and supportive systems. And this is just an example from that, where they're assessing if an organization is addressing spoken communication, and the organization is supposed to say if they think they're doing these different activities well, or if they need improvement, or if they're not doing it, or they're not sure. The Communication Climate Assessment Toolkit was developed by Matt Winia and others at the AMA. They refer to it as a 360-degree measure because they have different forms for different participants. It can be completed by organizational leaders, by physicians or other providers, and by patients. It covers 9 key domains and 9 of the 10 IOM, organizational health literacy attributes. It's available in 11 different languages, and it can be administered in person, online, or via phone. They've actually done some research demonstrating that it has some good construct validity with positive correlations between performance on the tool or the measurement scale and patient-reported quality of care and trust in their healthcare system. And they also demonstrated that it has some good internal reliability. Another great measurement tool is the Health Literacy Environment Toolkit developed by Rima and others. And I'm not just saying that because Rima is in the room. It really is a great tool that I'd encourage people to take a look at. It includes assessments for navigation, print communication, oral exchange, availability of patient-facing technologies, policies and protocols, use of plain language, and so forth. And it's been field tested in a lot of hospitals and some clinics and other healthcare organizations, both in the United States and in countries in Europe, Australia, New Zealand, and a couple of other places, Portugal. So in summary, I think we found 12 very robust measures for addressing organizational health literacy, which is actually more than we thought we were going to find when we started the process. Measures are designed for use sometimes by the organization, sometimes by patients, sometimes by the providers, sometimes by all three. Several of the measures were developed specifically to address organizational health literacy, but others were actually originally developed to try to address how patient-centered an organization was, or whether or not an organization was meeting criteria for a patient-centered medical home. And in that process, they were also addressing a lot of the attributes related to organizational health literacy. Most of the measures we identified have very good content validity, meaning they seem to be measuring the right things. It makes sense what they're measuring, but there's actually been very limited work to date to truly assess the construct validity or reliability of these tools. They're really very early tools, and there's not been a lot of robust work to see, for example, if they have predictive utility in predicting health outcomes over time. And as I mentioned, we found 27 measures that just address 2 to 4 of the attributes, and then 29 that only address 1 attribute, usually related to patient communication. All of these measures are in the report, so you can go online and see them all in several large tables. We were asked to try to determine how organizations were using these measures, and specifically if they were using them for reporting, accountability, management, quality improvement, and research. We did not find a lot of information at this point published about exactly how organizations were using these. I'm going to share a few stories in the next few slides, but we do feel that many of the measures that are out there really could be used for all 5 of these activities, and actually we would really encourage that. We think there are fantastic opportunities for organizations to use the measures that are out there, really to apply it to their system to improve how they address health literacy in all of these different areas. So there has been a wide distribution of some of the measures that I mentioned. The Joint Commission Roadmap for Hospitals has been downloaded over 40,000 times. The Health Literacy Environment of Hospitals, as I mentioned, has been used both nationally and internationally. The Communication Climate Assessment Tool has been accessed widely. The Health Plan Organizational Assessment of Health Literacy, which was developed by AHIP, American Health Insurance Plans, has also been distributed nationally. We basically got a convenient sample of organizations that reached out to us and told us that they were addressing organizational health literacy in some way. most are very early in their process. So they've gotten a tool or a few tools, and they've pulled together some questions from several different tools, and they're at the point where they're assessing health literacy, but they maybe haven't done a lot of action items to address health literacy or even to validate the tools that they're using. I will say many groups are now starting to hire staff in this space. So they're hiring someone in their patient education section of their health system, or in their patient engagement or patient experience section of their health system, to really start to address organizational health literacy, which is very encouraging. And Suter Healthcare in California is just one example of an organization that sort of mixed and matched. They took some materials from the ARC Universal Precautions Toolkit. They adapted some material straight out of the IOM paper on the 10 OHL attributes, and they took some measures from CAPS, and then they're using this amalgam to try to measure how they're addressing organizational health literacy to help drive organizational change. I mentioned the American Health Insurance Plans. They put together a health literacy task force of 65 member plans and developed this tool to look at how health plans address health literacy. And they've been able to push this tool out to their health plans and really encourage their health plans to use this tool as a way to assess how they're addressing health literacy and try to drive improvement in this space. A lot of groups are using the ARC Universal Precautions Toolkit. Novant and Carolinas, both in the southeastern United States, are using the Universal Precaution Toolkit as well as CAPS and other measures, again, to try to assess health literacy at their organization and really to start to try to make changes at their organizations to address it. So in conclusion, we actually found a robust array of measures that are now available that could be used or adopted for use by organizations. There are a lot of measures out there, some of which were designed specifically to address organizational health literacy, but a lot also that were designed to address patient-centeredness that also address organizational health literacy. A lot of the measures that are out there are designed only to be filled out or completed by the organization. My personal belief is that the ones that try to address organizational health literacy from all perspectives, the organization's perspective, the provider's perspective, and the patient's perspective, are going to be the most useful and the most robust measures. And we do feel that these measures can really start to be used now and are being used now for measurement, for accountability, and hopefully for quality improvement, even though the current data on the validity and reliability of these tools is still a bit limited. There's some limitations to our work. We relied mainly on the identification of published measures and those that were referred to us. We focused on English language only. It can be difficult sometimes to assign the individual measurement items to the 10 OHL attributes. And again, we were limited by who reached out to us to tell us about what they were doing at the organizational level. I do think there are a lot of great opportunities here to encourage organizations to review and choose from current measures. Many organizations right now are adapting measures for their individual use, and I think that's necessary, although we need to keep in mind that there's less validity if you take a few questions from here and a few questions from there and sort of put it together into a measure. The really ideal thing would be if we had a unified adopted measure that was used by many different organizations all at the same time and longitudinally over time. And then we really could look at what the variation is and how organizations are addressing literacy across the country or across the globe, and also could validate it as a tool in terms of looking at how well it predicts health outcomes over time. So I do feel like we are at a crossroads here. We are really at a tremendously opportune time to push for the importance of organizational health literacy. We have the Affordable Care Act with huge additional groups of patients getting insurance. We have the push for ACOs and a focus on population health. And really we have this huge almost renaissance of organizations and groups understanding the importance of patient-centered care and patient-centeredness. And so I think with that, there are tremendous opportunities right now to push organizations to measure and address organizational health literacy, and I hope the Roundtable can continue to lead that effort. Thank you.